Thank you so much for the possibility to share some biophotonics together with you here. And I will show some authentical pictures from Riga also, where we have done some of this work that I will present. As Sune, I have also a dual position both at the Lund University and at South China Normal University. And you can see the group up there in the corner. I will talk about some worldwide challenges, which really are challenges towards our health. And one major of these is the increasing incidence of cancer. Myself, I am professionally an oncologist, so this is of course something that I am very involved in and has been during many years. What we know is that early detection is really important for the prognosis of the patients, and also to develop minimal invasive therapy. And there is a very bad statistics here when we read that there will be a doubling of cancer cases until 2040. To the right there, you see the distribution over the world where all these cancers are happening, and we can see quite numbers that are interesting for the developing world. We also, of course, have the infectious diseases, and with them follow the antibiotic resistance, which is another threat to the world. I would say that the global warming, of course, is one major issue, but from my perspective, I believe that even the antibiotic resistance is worse. We have seen the coronavirus, which threatens the whole world, and that is a disaster, of course. I will more go in detail to the bacterial infections. Sune touched upon food quality a little bit, and I will give some epidemiological aspect of that. What you see here is that food is really related to the development of cancer. We believe, or statistics tell us, that food represents 30% of the reason genesis of cancer in the gastrointestinal tract. So this is something that we really have to take into very serious perspective. Others are, of course, air pollution, which we also heard about, tobacco smoking. What we cannot do anything about is what I have written there in biology, that's age. So age and tobacco smoking together are the paramount factors. What you also see there is that the social habits have importance. 20% of the global cancer death, for example, are related to smoking, and 70% of the global lung cancer death is related to that. What can biophotonics do, or can it at all help in some way? I said also that it's important to develop non-invasive or minimal invasive techniques. And one treatment modality is photodynamic therapy, which is one of these non-invasive, minimal invasive therapies for cancer diseases. And we were quite early starting the development in Lund. Already 1982, we started something we call biomedical optics, which was at that time a very new field. Very few people around the world, maybe 20 people, 4 groups worldwide, were involved in this area. And we started with photodynamic therapy as well as detecting cancers, early cancers. And you can see there that the first clinical PDT session in Scandinavia was actually performed in Lund. And the collaborators are many, as you can see here. And what is important to notice is the interdisciplinarity. We have people from the medical side, but also people from the technological, physics, chemistry side, which is important. And that has been the leading star for us all the time, to have this interdisciplinarity aspect. I said that early detection is one of the major factors for the prognosis of the patients. And I illustrate that here with a case of breast cancer, where you can see that stage 1, which is small tumor without any spread in the body, has a cure rate or a 5-year disease-free survival rate of 92%. While if we come to the more larger tumors with spread, dissemination, you see that the number goes down dramatically. So that's the reason why it's important to develop techniques for early detection. And one of these techniques are laser-induced fluorescence and reflectance spectroscopy. Both can be valuable. Here you see the excitation spectra and the emission spectra of the chromophores or fluorophores in the body. So you see that each of these compounds, either they are extracellularly located or inside the cell, they have their specific emission characteristics. The peaks differ, as you can see, as well as, of course, the emission. And by combining the spectral information from these, you can characterize also very early cancer before the cancer is visible with conventional techniques. As we show here, for example, where we have the case of urinary bladder cancer. And you can easily see when we, for example, move in a scan through the inner wall of the urinary bladder, how the spectral information changes if we go from tumor out into normal tissue. You can follow the scan easily here and see how it differs. Or in the imaging mode, which we show here to the right, in particular, the picture below there, which is some collaboration with the Munich group, where you see the endoscopic view of the bladder wall with one tumor stretching out there. And if you look at the fluorescence image, you see the clear red fluorescence. But on the other hand, if you look a little bit on top of that tumor, you see an area which for the naked eye looks very normal, but still in fluorescence shines up brilliantly. So this is a good example where we can show that for the eye invisible tumor can be made visible by laser-induced fluorescence. Or this one, which is one of my own patients with a tumor on the back of the patient, approximately 5 centimeters in length. And you see the image, the fluorescence image overlaying the tumor perfect to the right there. But you also see one little spot which has no fluorescence. And the reason for that is that it is a benign nevus. It's only a brown spot. And here we show how specific fluorescence can be in detecting cancer tumors. I started with talking about photodynamic therapy, which is a minimally invasive modality. And what you see here is the physics behind the technique. 3 compounds or 3 aspects are necessary. A sensitizing agent, something that we deliver to the patient. The light, we chose light of appropriate wavelengths, which has its maximum at the absorption peak of the sensitizer, and we also utilize the oxygen in the tissue. And these 3 together, compared in a smart way, can do the tumor to kill, can kill the tumor by utilizing the physics as you see to the right there. The excitation means that the molecule gains energy, and the excess energy is given over to the triplet state, oxygen, which in turn is transformed to singlet state oxygen, which is very toxic. So this is exactly how photodynamic therapy works in reality. And here you see a good example on the skin, a tumor which was treated with this technique. And you see to the right a fully recovered skin area with absolutely no sign of the tumor, as well as here with a cutaneous T-cell lymphoma, a little bit more dangerous, more aggressive tumor, but you see the same good result. And we should note that this patient had gone through 9 cycles of cytotoxic therapy in the blood therapy, but still he had this tumor, which was not cured, but we could help him with photodynamic therapy. There is, of course, a limitation, and that's a light penetration into tissue, which is limited. And therefore, we have to be smart and overcome this. And one way of doing that, or I would say the only way of doing that, is to put the fibers right into the tumor and let the light shine to the tumor from inside. And that's what we show here, one of the first patents by Katarina Svanberg, when he draw the design of a new aspect of photodynamic therapy with interstitial PDT, letting the fibers which are delivering the light to the tumor also be the ones that collect the information, the optical information from the tissue, such as scattering, absorption, oxygen content, and also content or concentration of the sensitizing agent. And interestingly enough, we did one of the first studies with this technique in Riga, together with Latvian Oncology Center. And you see here Alexander Deryabo and Yanis Kaposkins, who were collaborating with us, as well as other colleagues you see in the picture below there. And we started to do some study with the Latvian colleagues, took it further after very, very encouraging approach that we had there to test or to develop the technique for more sophisticated tumor delivery, like we show here for the prostate cancer. And you see the fibers positioned in an optimal way to fill the whole tumor volume with the light. So one challenge is really recurrent prostate cancer after ionizing radiation. We know that the patient group is big here. Approximately 15 to 20% of the prostate cancer cases recur even after ionizing radiation. And these patients have not any possibilities or any good possibilities for a second round of treatment rather than only hormone therapy. So this is the niche of a clinical trial that is performed now in collaboration with a small a company that has further developed the instrumentation that I showed Sune's patent from. And here is the interstitial PDT instrumentation with 18 treatment and diagnostic fibers, which can, besides, as I said, monitor the light, also the sensitizer fluorescence and the tissue oxygen. And this shows how the technique works with the prostate below the urinary bladder and how the fibers are inserted through the matrix. And as I said, both deliver light and also deliver back the information about the optical properties of the tumor. And this is how it looked like in the clinical situation with the ultrasound building up the tumor volume or the treatment volume placing the fibers through the matrix to the correct places, which is calculated by the instrument, and then let the light shine. All 18 fibers here delivering the light into the tumor with the ultrasound transducer, as you see in the rectal wall. And the trick is to give, of course, the prostate tumor the correct dose, at the same time spare the organs at risk. And that is exactly what this modality has the possibility to do. And a worldwide, or at least 2-country study is ongoing since April 2017, both in Toronto in Canada and in London at Medical College. Infectious diseases and antibiotic resistance, I touched upon that in my beginning here. And as you can see, 25% of the death worldwide, according to World Health Organization, is due to infectious diseases. And the threat is that there is a development, a very quick development of antibiotic resistance. This is the map, the worldwide map of methicillin-resistant Staphylococcus aureus. You can easily see that many countries are really affected by that. And if we look at Europe, the situation looks like this, with the southern part of Europe more influenced by this than the northern part. And you can also see Latvia there has a little bit higher numbers than, for example, Scandinavia. What can we do, and what is the history behind that? Yeah, we know that penicillin was discovered by Alexander Fleming. He got the Nobel Prize 1945, and he foresaw in his talk when he delivered his Nobel lecture that it is not difficult for the microbes to be resistant to penicillin, and that is exactly what has happened. And what you see there, the blue figure represents the situation for tuberculosis, where first-line antibiotics and also second-line treatment has no efficacy anymore. So there are, as we can see, almost no treatment options still there. And are we returning to pre-antibiotic area? That's a question.
You have 2 minutes left.
Sorry?
You have 2 minutes left.
2 minutes, okay.
Yes.
Okay, I show very quickly my last part here. And this is the frequency of antibiotics being developed. And you see that it's a declining number. Soon I touch upon the gas in scattering media absorption spectroscopy and gave the physics behind here. We have used this for sinusitis in exactly the same situation to try to take down the use of antibiotics. And we did clinical trials where we used the laser for oxygen and the laser for water vapor to normalize our signal and get the concentration. And we could see that our results were in correspondence to the CT results very nicely, as I show here, and including this also tells exactly the same thing. We have tested the stability of the test. We have tested different kind of drugs, how that can be monitored by the technique. Also for the ear infection, we have the same situation with overprescription, and we try to develop good guidance for the doctors to be used, as well as in orthopedics, where we can foresee the development of arthrosis and can tell the doctors how the situation is different for patients who are healthy and who are developing arthrosis, and combining that with laser Doppler. Last part of my talk, I will only mention a few pictures or tell you together with a few pictures about another project where we monitor small kids' lungs, the born babies who are a very vulnerable patient group and who need good non-CT, non-ionizing radiation-based diagnostics. And we believe we can help there with surveillance 24 hours of these small kids. And also we are trying now to take this to big audience, to big people. And that is, of course, a very relevant situation with the COVID. And this is how the first experimental work has been done there. So with this, I thank you so much and show these nice pictures from Riga, where you can see the skyline of Riga, a wonderful city, which both Sune and I love very much. Thank you so much.
Okay, thank you for your interesting presentation. I think we don't have time for questions. I just can comment, so it's exciting that you went over the phase from laboratory to this real treatment, and it's very useful, and we can learn from you much in this direction. Thank you.